So I'm going to go over a few of the things that should make you call us if you notice them in the 6 weeks after you've had your baby. You are going to experience lots of things in this postpartum period that are new or different, and they might even be scary. Most of them are totally normal, but these are a few of the things that we would really like to hear from you if you experience. We talked about the bleeding. So again, if you're soaking through 2 thick pads in an hour and that continues on for another hour or two, you should give us a call. Or if you're having clots that are like larger than a lemon and you're bleeding with it as well. If you're having pain that's really not controlled with the pain medications that we've recommended for you to take at home, that's a sign that we should check out what's going on. You know, whether that pain's in your breast or your belly, if you've had a C-section, it's in your incision or it's in your vaginal area. Any pain that's not controlled with the pain medications should prompt you to give us a call. Any fever that is higher than 100.4 degrees Fahrenheit is important to call. Additionally, if your lochia, which is the name for the bleeding and the discharge that you have after you've had a baby, if that suddenly becomes very foul smelling or sort of rotten smelling, it smells different than it did before, and especially if along with that you have a fever or you're having more pain or cramping, that would be another reason to give us a call. Sometimes people can get a bladder infection after they've had a baby. So if you have symptoms like it hurts when you pee, or you feel like you're constantly trying to go, but then you can't really get it out, that would be another reason to call. We talked a bit about constipation and how to manage that. It's very normal to have constipation, but if it's gotten so severe that you haven't been able to have a bowel movement for 4 days or longer, we definitely want to hear from you. Additionally, many women experience the postpartum blues after they've had a baby. That's really normal, for a limited period of time. But if you feel like it's just not getting better after about a week or so, you're feeling symptoms of depression, anxiety, having a hard time sleeping, or maybe you feel like you just want to sleep all the time. If you have any thoughts of wanting to hurt yourself or your baby or anyone else, that would be a reason to call us right away, even if it's the middle of the night. We talked about some of the symptoms of infection that could happen in your breast. We call this mastitis. There's redness, soreness, along with a fever. Or if you're having difficulty with breastfeeding, maybe you're having a hard time getting your baby to latch without pain, or your nipples are persistently cracked and bleeding, please give us a call and we will be happy to connect you to more resources for help. There's a couple other things that relate to the women who have had a C-section, or if you've had a tubal ligation, which is typically a little incision right underneath your belly button. If any of those types of incisions show redness, swelling, there's fluid coming from the incision, or there's bleeding, or it actually opens up, if it's really firm or warm around it, or even if it just hurts more than it did before and you're taking your pain medicines, again, those are things that should make you want to give us a call so that we can see you. And additionally, if you had preeclampsia during your pregnancy or in the postpartum period, it's really important that you call us if you have a headache that does not go away with Motrin or Tylenol, or if you have visual changes or blurry vision, or if you have pain like up in the right upper part of your belly or kind of towards the middle. Those would be reasons that we need to check your blood pressure and see how things are going.